These are two-dimensional CT DICOM images of our 86-year-old male with degenerated bioprosthetic mitral valve. The three-dimensional spatial relationship between the bioprosthetic mitral valve and the adjacent structures is difficult to appreciate. Instead, what we have developed is a three-dimensional virtual reality image of our patient in which the spatial relationship between the structures is more easily visualized. This is the initial pre-procedural fly-through model of the patient's chest. We're able to fly into the patient's thoracic cavity and clearly see the spatial relationship of the cardiac structures. We now start peering in through the ascending aorta and fly through the bioprosthetic aortic valve in order to better appreciate its spatial relationship with the bioprosthetic mitral valve and the left ventricular outflow tract. You can clearly see here the relationship that the bioprosthetic mitral valve has in respect to the interventricular septum. We're now able to model where the SAPIEN 3 valve would sit as we project it into position inside of the bioprosthetic mitral valve.
So now that we've positioned the SAPIEN 3 valve inside the mitral bioprosthetic valve, we use a function of the program in order to measure the neo-LVOT area. So we select this polygon, and one of the nice features about VR is that we're able to place the polygon and measure the area exactly where the smallest neo-LVOT area will be. I click on the edges of the polygon and start moving them and making sure that they're at the right area by moving in and out of tissue planes or the valve planes. And generally what I do is I work my way around, sometimes going from one edge of the polygon to another until I'm fairly confident that I'm measuring the neo-LVOT. As you can see here, I'm nearly done positioning the edges of the polygon, slowly moving them to approximate what the neo-LVOT area will be. Once I think I'm in the right position, I can view this plane from different angles and ensure that it in fact is measuring the neo-LVOT. That's the benefit of virtual reality. You know exactly where you are, and you can be confident of your measurement.
The virtual reality model created 1 month post-percutaneous mitral valve and valve replacement was obtained in order to determine if there was a significant left ventricular outflow tract obstruction from the SAPIEN 3 valve. The model clearly demonstrates how accurate our pre-procedure planning was in correctly predicting where the SAPIEN 3 valve would land. We can clearly see that the left ventricular outflow tract is not obstructed. We can also appreciate the spatial relationship between the bioprosthetic mitral valve, SAPIEN 3 valve, bioprosthetic aortic valve, and the intraventricular septum, thus underscoring the benefits of 360-degree virtual reality modeling for the structural heart disease patient.